Saxagliptin/metformin, also known as Kombiglyze Xr, is a medication used to control high blood sugar in people with type 2 diabetes. It is important to take Kombiglyze Xr as part of a proper diet and exercise program to help prevent kidney damage, blindness, nerve problems, loss of limbs, and sexual function problems. Proper control of diabetes may also lessen your risk of a heart attack or stroke. Kombiglyze Xr contains two medications, Saxagliptin and Metformin. Saxagliptin works by increasing levels of natural substances called incretins, which help control blood sugar by increasing insulin release, especially after a meal, and decreasing the amount of sugar your liver makes. Metformin works by helping to restore your body's proper response to insulin, lowering blood sugar, and decreasing the amount of sugar that your liver makes and that your stomach/intestines absorb. It is important to take Kombiglyze Xr exactly as prescribed by your doctor, usually once a day with a meal. Be sure to follow your doctor's instructions for the best time to take this medication to get the most benefit from it. Before you start taking Kombiglyze Xr, make sure to read the medication guide provided by your pharmacist. If you have any questions, ask your doctor or pharmacist. Take this medication by mouth as directed by your doctor, usually once a day with the evening meal. Swallow the tablets whole and do not crush or chew them, as it can increase the risk of side effects. Make sure to drink plenty of fluids while taking this medication unless otherwise directed by your doctor. The dosage of Kombiglyze Xr is based on your medical condition, response to treatment, and other medications you may be taking. Your doctor may direct you to start this medication at a low dose and gradually increase your dose to reduce the risk of side effects. Be sure to tell your doctor and pharmacist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. Take this medication regularly at the same time each day to get the most benefit from it. Be sure to follow the medication treatment plan, meal plan, and exercise program recommended by your doctor. If you experience any of the following side effects, be sure to inform your doctor or pharmacist right away: nausea, vomiting, stomach upset, diarrhea, headache, or a metallic taste in the mouth. If any of these symptoms persist or worsen, contact your doctor. Also, if you notice an empty tablet shell in your stool, don't worry, this is harmless because your body has already absorbed the medication. It's important to remember that your doctor has prescribed this medication because they believe the benefits outweigh the potential risks. However, it's essential to report any serious side effects to your doctor, such as joint pain, unusual skin blisters, or signs of heart failure. While Kombiglyze Xr usually does not cause low blood sugar by itself, it may occur if you are taking it with other diabetes medications. Be sure to discuss all of your diabetes medications with your doctor or pharmacist. If you experience symptoms of low blood sugar, such as sweating, shaking, or blurred vision, it's important to raise your blood sugar quickly by consuming a source of sugar. If you notice any symptoms of high blood sugar, such as increased thirst or urination, contact your doctor immediately. In the rare event of a serious allergic reaction, seek medical help immediately. And remember, this is not a complete list of potential side effects, so be sure to contact your doctor or pharmacist if you experience any other unusual symptoms. Sometimes, too much Kombiglyze Xr can build up in the body and cause a serious condition called lactic acidosis, which can be fatal. This is more likely to happen if you are an older adult, have kidney or liver disease, dehydration, heart failure, heavy alcohol use, have had surgery, have had X-ray or scanning procedures that use iodinated contrast, or are using certain drugs. If you experience symptoms of lactic acidosis such as unusual tiredness, dizziness, severe drowsiness, chills, blue/cold skin, muscle pain, fast/difficult breathing, slow/irregular heartbeat, or stomach pain with nausea/vomiting/diarrhea, stop taking this medication and seek medical help immediately. If you have any concerns or questions about taking this medication, talk to your doctor or pharmacist for more information. Before taking Kombiglyze Xr, make sure to tell your doctor or pharmacist if you are allergic to Saxagliptin or Metformin, or if you have any other allergies. It's important to also discuss your medical history, especially if you have kidney disease, severe breathing problems, blood problems, liver disease, pancreatitis, or if you are at risk for pancreatitis. If you need to have surgery or any X-ray/scanning procedure using iodinated contrast, talk to your doctor about the medications you are taking. You may need to stop taking Kombiglyze Xr for a short time before the procedure. When taking Kombiglyze Xr, be aware of the possible side effects such as blurred vision, dizziness, or drowsiness. It's important to limit alcohol consumption as it can increase your risk of certain conditions. If you experience high fever, excessive sweating, diarrhea, or vomiting, make sure to stay hydrated and contact your doctor if these symptoms persist. It's also important to note that Kombiglyze Xr can affect the menstrual cycle and increase the chances of pregnancy, so discuss reliable birth control methods with your doctor. If you are pregnant or breastfeeding, talk to your doctor about the risks and benefits of taking Kombiglyze Xr during this time. Your doctor may need to adjust your treatment plan accordingly. Drug interactions can have an impact on how well your medications work and can also increase the risk of serious side effects. It's important to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. It's important to note that other medications can affect the removal of Saxagliptin from your body, which may affect how Saxagliptin works. For example, azole antifungals, HIV protease inhibitors, nifazodone, telithromycin, and ritonavir can all have an impact. Additionally, beta-blocker medications may prevent the fast or pounding heartbeat you would usually feel when your blood sugar falls too low. It's also important to be aware that many drugs can affect your blood sugar, making it harder to control. Be sure to talk with your doctor or pharmacist about how any medication may affect your blood sugar, and check your blood sugar regularly as directed. And be sure to tell your doctor right away if you have symptoms of high or low blood sugar. Your doctor may need to adjust your diabetes medication, exercise program, or diet. If you or someone you know has taken too much Kombiglyze Xr and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call 911 or your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center. Overdosing on Kombiglyze Xr can lead to a condition called lactic acidosis, which can cause symptoms such as severe drowsiness, nausea, vomiting, diarrhea, rapid breathing, and a slow or irregular heartbeat. If you suspect an overdose, don't wait, seek help right away. It's important not to share Kombiglyze Xr with others. Make sure to attend a diabetes education program to learn how to manage your diabetes with medications, diet, exercise, and regular medical exams. Learn about the symptoms of high and low blood sugar and how to treat low blood sugar. Be sure to check your blood sugar regularly as directed. Before starting Kombiglyze Xr and while taking it, you may need to have lab and/or medical tests done, such as kidney function, liver function, blood sugar, hemoglobin A1c, and complete blood counts. It's important to keep all medical and lab appointments and consult your doctor for more details. If you forget to take a dose of Kombiglyze Xr, take it as soon as you remember. However, if it's almost time for your next dose, just skip the missed dose and take your next one at the regular time. Do not take a double dose to make up for the missed one. It's important to stick to your regular dosing schedule for this medication to work effectively. It's important to store Kombiglyze Xr at room temperature, away from light and moisture. Be sure to keep it out of the bathroom and where children and pets can't access it. When it's time to dispose of any unused or expired medication, don't flush it down the toilet or pour it down the drain unless instructed. Instead, consult your pharmacist or local waste disposal company for proper disposal methods. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.